Okay, Mr. Jones, just keep still for me. Keep still.
I just need a minute.
How you doing, Mr. Jones?
I just need my...
Okay,
I
that's
just
okay.
need my...
What are you looking for,
I just
Mr.
need
Jones? Is Mr. Jones a diabetic?
Yes, insulin control.
Yeah. Do you want some sugar?
If at any point the patient seems unwell, stop treatment, make the situation safe, get help, and locate your medical emergency equipment, including treatment algorithms.
Yeah.
Okay, we'll give you some sugar. Let's get some medical emergency kit. Let's get some more help in here.
I don't feel well.
Because the patient is talking in complete sentences, we know the airway is clear.
Could you come in, please?
Just get you relaxed there.
I don't feel well.
All right then, just lay there for me. If we go straight for the glucogel, his airway's okay. Mr. Jones? Mr. Jones?
Should the patient become unresponsive, or if you are at all worried, don't be afraid to activate emergency services early.
Okay, Pert, let's go straight for the glucagon.
No, you call 999, please, Chris. Tell them we've got a diabetic patient who's dropping his conscious level.
Let's go for the oxygen and a milligram of glucagon.
Yes, that's the correct address and telephone number. No, he's not conscious. Yeah, he's breathing normally. The patient's a diabetic. I think the dentist is with him. That's great. I'll look out for the ambulance car.
Count the respiratory rate. Attach oxygen saturations if you have it. Consider the colour of the patient and look for normal chest movement.
Okay, Mr. Jones, what we're going to do is we're going to draw you up an injection. Chris, can you start taking notes? Just document everything that we do and what time we do it. Okay, he's got a pulse of 92 and his capillary refill time is less than 2 seconds.
It is important to document what happened as it happens if possible to ensure accuracy of times, drug doses and the condition of the patient.
The glucagon's going in now. And let's just check that blood pressure.
Feel for pulses, assess capillary refill time and check blood pressure if you have the equipment. Also feel the skin temperature.
Cody, if I can have a blood glucose, excellent.
Sharp scratch on your finger, Mr. Jones.
In disability, assess level of consciousness by using the AVPU score. Check the patient's blood sugar levels and if they're conscious, ask them to move their limbs to look for any signs of weakness.
2.1.
2.1, okay. Hang on, Mr. Jones, can you hear me?
If at any point the condition of the patient changes, stop and go back and reassess airway.
Pedro, can you sort out his airway? He's got an airway there handy. No, okay, that's not going to go in, so don't worry about that. I'll just put the oxygen back on, I'll just keep that up on there. And then if you just go to the bottom of his legs there and see if there's any rashes down there, Perd.
Exposure of the patient in the dental setting can be difficult, so whilst respecting dignity, look for signs of rashes, bleeding, injury or bruising.
Okay, so let's start again and reassess.
After exposure of the patient, reassess using your A, B, C, D, E approach.
Airway's clear, but he's got a bit of a problem with his tongue, but that's okay. Breathing respiratory rate is 14. His SAT's on 97%, so that's good. Pulse is 92. Blood pressure, what did I say that was? That was still 130 over 70. Right, well, so we just wait to see that glucagon works and wait for the paramedics to turn up. Okay. Cool.
Hello, Paramedic here.
Oh, thanks for coming. This is Mr. Jones. He's a 34-year-old known type 1 diabetic, takes insulin, and he went hypo on us following a procedure. His airway's clear, respiratory rate is 12, SAT's 97%, pulse is 92, nice and regular, capillary refill time is about 2 seconds. As you can see, he's pretty flat, responding to pain. His BM is 2.1, nothing else on exposure, and we've written everything down for you, ready to go.
Thank you. Can I get a copy of those notes? I'm just going to have a listen to his chest and then I'm going to get some IV access.
So in summary, if you think someone is becoming hypoglycemic, stop dental treatment, make the situation safe and assess the patient using the structured airway, breathing, circulation, disability and exposure approach. Call for help and give high flow oxygen with the correct oxygen mask. Treat the conscious patient with glucogel and the patient with a lowering level of consciousness with 1 milligram of intramuscular glucagon. Use treatment algorithms to remind you of the guidelines. Ensure the emergency services are called early and prepare for handover. Document what happened as it happens if possible and debrief your team after the event.